right, we'll get started. Good evening, everyone, and welcome to the Healthy Living series. This one is called, But Do I Still Have to Wear a Mask? Your guide to the COVID-19 vaccines. And we have a great panel of doctors for you today. We have Dr. Michael Calderwood, our Chief Quality Officer here at Dartmouth-Hitchcock Health. We have Dr. Jonathan Thyng from Dartmouth-Hitchcock Nashua. He's our medical director at Dartmouth-Hitchcock Nashua. And we have Dr. Erik Shessler, our Chad pediatrician from Manchester. So thank you all for being here and welcome.
Thank you. Happy to be here.
So just a few housekeeping things. My name is Angelica Ladd. I work in external affairs at Dartmouth-Hitchcock Health, and I help to organize this event. I'll be your moderator tonight. If you have questions other than the questions you submitted at registration, you can feel free to use the Q&A function on Zoom webinar feature, and we will try to field all of those questions for you tonight. We are here for about an hour, so if we can't get to your question, you can always submit questions in the survey, which you'll receive at the end of the event. So those surveys are also really important. They help us to create programming for you in the future. So please feel free to, submit that survey. And again, if you have questions that didn't get answered tonight, feel free to use that survey as your tool. This event is being recorded. It is going to be live on our YouTube page and will be on our COVID-19 vaccines page at dartmouth-hitchcock.org. So if you miss any part of it, it will be available within the next few days. And I think that is it. So with that, we're just going to get started. Again, use that Q&A function if you need, if you have a question. But first, I'd really like to get started. Dr. Calderwood, you do a lot of these events and you know a lot about the vaccines, and we're very fortunate to have you. And so if you could just give us kind of an overview of where we're at with the vaccines here in New Hampshire, that'd be great.
Sure. So we currently have 3 available vaccines. We have the initial 2 mRNA vaccines. That's that newer technology that brought the Moderna and the Pfizer vaccine to market very quickly. Those have the limitation that they require 2 doses, either 3 or 4 weeks apart. And then we've had the newer vaccine, the Johnson & Johnson or the Janssen vaccine, which is the latest one. It's a kind of more traditional technology for a vaccine. And I can talk about some of the comparison between them. The benefit of it is it's a single dose, and it is beginning to ramp up. And so we are seeing more and more people that are receiving that vaccine. But since the beginning, when we started giving vaccines in December, most people in the state of New Hampshire have either gotten the Moderna or the Pfizer, just because those came out first. Overall, actually, the vaccines have been extremely well tolerated. We've been seeing, we have the expected reactions that people have, that people may feel like they have a viral illness for a day or so, sore arm. Sometimes after the second vaccine of the Moderna and the Pfizer, we've seen some people that have a short-lived fever. But a lot of the things like anaphylaxis and more significant side effects have been extremely rare. In fact, we observe people after giving the vaccines, but have not seen a lot of those, thankfully. And we're seeing a lot of good data now that we've seen people who, from the trials, have had these for a number of months, that really look at these being quite effective in providing protection. And the protection is really in terms of preventing people from being hospitalized, ending up in an ICU, and dying. I think that's important because people try and look at the data and get a little concerned when they see differing numbers. And some will say, oh, it's 95% effective, and some will say it's 66% effective. And what you really want to look at is what is the effectiveness of preventing people from getting severely ill. And so we know with other things like the flu vaccine, that, in a given year with the flu vaccine, 4 out of 100 people will get flu without the vaccine, and that goes down to 1 to 2 with the vaccine. People still get flu, but when they get it, it's much less severe and much less likely to end up in the hospital. So that's the same thing with this vaccine for COVID-19. And the other thing to look at is there's a lot of concern about these variants and the circulating variants, but we actually have fairly good data for some of the most commonly circulating variants from the United Kingdom, South Africa, and Brazil, that actually for severe illness, these vaccines are still effective. You may see some breakthrough mild illness, and that may lead to people who are sick and at risk for transmitting after the vaccine. But again, we want to focus on the severity, because that's really been what's impacted us so much with COVID-19 in terms of hospitalizations and the absolute number of deaths across the country, which has been tragic.
Yeah, so I mean, speaking of, where like how the vaccine, when you get the vaccine and it's like the flu shot, like can still get the flu, but it doesn't necessarily, this with a vaccine for COVID-19, you don't necessarily prevent transmission. Like you can still get sick, and you can't prevent transmission. Is that right?
That is right. I think that it's a bit of a nuanced discussion. What we know is that people who've had the vaccine, when they end up getting sick despite the vaccine, tend to have much milder symptoms. And that's partially because they have much lower levels of the virus in their bodies. That means they're shedding less. So on the one hand, yes, you are less likely to transmit to others. On the other hand, you actually often don't even know you're sick because you may be asymptomatic or mildly symptomatic. So you're out in the community. So to a degree, that actually puts that risk of transmission a little bit higher. And that's what we're trying to walk that line in, making sure that people are still masking and socially distancing until we get enough people vaccinated, because it is possible that you could still be a risk to others. You yourself are not severely ill, and that's great. But those who have not been vaccinated, we want to make sure we're protecting them.
Great. Thank you. So the other big topic, I think, is the protection against the variants. Is there enough data yet to assume that these vaccines can prevent illness with the variants?
So I think we have data out of Israel, we have data out of the Janssen trial, we have data out of the UK that for severe illness, these vaccines are still effective. I would say that some of the early data on 95% effectiveness may be slightly lower as we get these newer variants if we take all cases of disease, including mild illness. But they are effective in terms of preventing hospitalization and death. I think the big concern with the variants is that they're much more infectious. And so if one person is infected, they're more likely to spread to a higher number. And some of them have been, particularly in individuals before they get vaccinated, associated with a higher rate of mortality. And in fact, if you look at the mortality data, we had seen things get down to kind of 1.6% mortality, so between 1 and 2 out of 100 that were dying. That has been slowly going up since we've been seeing these circulating variants. It's probably in the 1.8 range in the US, but in South Africa and Brazil, they're in the 2 to 3% range. So these variants are absolutely causing a lot of concern in terms of higher mortality.
So we're getting some great questions in as well from our audience. One of the questions is, do we know the length of time that the vaccine is effective at protecting against COVID? Will this be an annual vaccination? Will there be a boosters required? I think, so that's been an interesting question.
Yeah, so I mean, what we know is that the antibodies that develop after you get the vaccine are detectable at least out to 6 months. And if we think about the amount of time that these vaccines have been available and in large populations, we don't have all the data yet. So at this time, there actually are trials that have begun around booster doses. And there is a thought that into next fall, into next winter, you might see people begin to get boosters very similar to the flu vaccine. I will say that right now, the focus is on making sure everyone who steps forward has access to the first round of vaccines. The benefit of the mRNA vaccines is that they're actually quite quick in order to be able to swap one piece of messenger RNA out and put a new one in. And so if there are changes in the spike protein, which is what many of these are targeting, you can change the messenger RNA to affect against those changes very quickly. And that's probably what the boosters are going to do. I know that the two companies are looking at that because I know their trials have begun.
Right. Thank you. Dr. Shessler, let's talk about kids for a moment. We know that we haven't had, we're in the trial process for vaccines, but just curious what your thoughts are on kids going to summer camp this year and participating in activities as we kind of move forward.
Sure. So I think the important part when we think about this is that we just want to make sure the kids stay safe and healthy. And part of them staying healthy is to get outside, get some activity moving, get out, chance to enjoy the fresh air and get some exercise kind of thing. So figuring out ways for us to be able to do that in as safe a method as we can. And so with, schools are a similar kind of topic. The discussion when we think about this is what type of strategies can we use to decrease the risk? We can't eliminate risk, but we're trying to decrease the risk so that we can get, kind of kids and families back to as normal an activity level as we can. So, at schools, for example, that are, hybrid or now moving back towards full opening, we've got things like you've got masks in place. And so kids over the age of 2, we have a lot of data that even kids that have various health issues are quite successful at being able to wear a mask for us. So wearing a mask is one of those strategies. The physical distancing, and I always like to joke that we want to do physical distancing, not social isolation. So we want social togetherness, but physical distancing. So physical distancing is one of those other strategies that we can do. Summer camps, for example, since you brought them up, can employ some other kind of strategies where we say, hey, do we want to have everybody to get a COVID test before they go into their summer camp so we can make sure that we can keep them cohorted? Are there going to be groups within the summer camp that are going to be hanging out together so that if we do have any kind of exposure or issue, they don't have to shut down the entire camp. They can actually just kind of keep things isolated a little bit more effectively. Having some good strategies with regards to hand washing and hygiene is another big piece. The benefit in the summer and the summer camps is that the vast majority of the activities are outdoors. And we know that the transmission of cases for COVID-19 are dramatically less when we're talking about outdoor activities versus indoor activities. So as we move into spring and summer and we get a chance to have soccer or other different various activities, that's a different level of risk that's lower than, say, an indoor activity like basketball or hockey. And so as we move forward, just kind of thinking about what can we do to kind of keep decreasing the risks. Again, we can't eliminate it, but we can decrease it. So what types of activities and things can we open up that allow kids to get back to a more healthy and environment that we want them to be able to get to?
Thank you. And I know that another question that we had was in regards to nursing mothers, and do their babies get any protection from the breast milk?
So great question. And so in general, we know that any vaccines or illnesses, for example, that mom has had, and she'll have circulating antibodies in her blood. And so with breastfeeding, you're actually sharing a good portion of the antibodies that you have with your baby. The question that we have for various things, and what we don't quite know yet for COVID-19 is the little bit of antibodies that that moms are sharing through breast milk, is that actually enough to protect their baby, and to what degree? We don't have the data to be able to know whether that adds a significant level of protection. But yes, some of the circulating antibodies in mom's blood gets into breast milk and is passed to babies through breastfeeding, which is fantastic. And that's one of many reasons why we recommend breastfeeding as kind of our kind of gold standard for feeding, that we have lots of other ways that we can feed babies, which works out beautifully, but breastfeeding has lots of advantages. And one of them happens to be that antibodies get passed through breast milk.
Great. Thank you. And then we have a few more questions that are coming in. The one question is, if you have the option to choose a vaccine, what should we choose? Is there a choice to be made, or should we just get what is offered to us?
So in general, the recommendation is whatever is available is actually what you should get. They are equally effective in terms, again, of prevention of severe disease. The one difference is that the Pfizer vaccine has a approval down to age 16, and the Moderna and the Janssen vaccine start at age 18. So in those individuals coming for vaccination between 16 and 18, there's only one choice of what they can get. It really doesn't mean that the others are not safe in those age groups. It's just that they were not studied in that. And in fact, we're getting studies all the way down to kind of age 6 and kind of school age on up. And so, beginning in the summer, there's an expectation that we may begin to think about, okay, when are children going to be eligible and what does that mean for start of school? And we're beginning to get that data. But otherwise, beyond that 16 to 18 group, it really is what is available on the day. And the state is taking shipments and kind of allotments differ week to week. So it really depends, but you don't have much of a choice at this point. If you choose to wait, and we mean wait months and months, you'll eventually have a choice. But given the supply issues and getting them into arms as quick as we can, particularly that they come often in multi-dose vials, you get what is there on the day you go.
Great. Thank you. And then maybe just a little bit of myth busting about the mRNA. What is mRNA? Does it change your DNA? Does it make you have superpowers?
Well, yeah. So one would like to think that vaccines give you superpowers because you are at lower risk for disease. But no. So the messenger RNA you can think of as essentially the code to tell your body how to produce the spike protein to present to your immune system. And so when it's injected into your arm, it's taken up by cells that bring it to the lymph node, typically in your armpit. That's why some people have seen some swelling of those lymph nodes. That's actually your body developing immunity. The messenger RNA goes into the cell. It never goes into the nucleus, so it doesn't impact any of your DNA, but it is read and turned into proteins. It's not turned into the virus. It's turned into just that single protein and put onto the surface. And then your immune system recognizes it and says, that's different. I should develop some antibodies against it. It develops those antibodies, your immunity develops. And then actually the messenger RNA is very short-lived. It actually degrades and goes away. So it's not something that sticks around. It's nothing that gets into your nucleus, and it's nothing that impacts your DNA.
Thank you. Let's just switch gears a little bit to what people can do when they are vaccinated and how they can behave. I know we're all just itching to get back with our friends and our families. So, I saw a really great graphic from the CDC. I think it came from you, Dr. Calderwood, about how we can be with people again, and what those combinations might look like. So I'll just show that now. And if you want to kind of talk about that.
Sure. So I assume you're going to put that up, but
yeah.
So the CDC is really going in a stepwise approach as we get more and more people vaccinated, and thinking about how we begin to open up areas of our society so that people can really begin to gather together. And so this is a graphic that's on one of their websites. I want to highlight, because this was a big issue that people didn't really fully understand from the CDC's messaging. This is about personal residences. This has nothing to do with public environments. It has nothing to do with residences. It has nothing to do with large group gatherings. In a personal residence, in your home, you may gather together with other vaccinated individuals without wearing masks. If you are kind of gathering with one other family and you're vaccinated and they're not, you can do that similarly. As soon as you add kind of multiple family units and it's only a portion of those that are vaccinated, this is where the masks and the social distancing in terms of both the duration of time, how many people in the room, the ventilation, et cetera, becomes important. So what I would say, for instance, we have a lot of grandparents who are now vaccinated. Increasingly, a lot of parents who are now vaccinated. They can begin to gather with their families, including with children who are not vaccinated. They can hug, they can kiss, they can have, if they feel comfortable. Now, some may still choose to wear masks, but they can do that without masks. I can say that, in my family, my wife and I are healthcare providers. We've been vaccinated. My in-laws have been vaccinated. And we had them with us recently. It was the first time in a very long time. But they stayed the night and they had dinner, and we actually had a cake talking about how much we love science. And it was a powerful thing. But that was that first step. Am I going to have a large dinner party? Probably not. Could I do it if everyone was vaccinated? Sure. But the more people you have in the room, we just have to recognize the vaccine is not 100% effective. And we have to realize that as that number increases, and we know certain states are beginning to open things up. So say that you can have as many as 100 people indoors or as many as 200 people outdoors. That really is dependent upon low occupancy. So they're focused on 50% occupancy and ability to socially distance. And in all of those environments, it's with people wearing masks. If you're going to gather and eat, we're still at a point where we're saying individual tables where you're taking off that mask shouldn't have more than 10 people. And if you're getting up to move around, you should put on a mask. And that's how this is the first step. We're in a pretty good spot. We have over 70% of people who are 65 and older who have thus been vaccinated across the country. We're approaching 35% of those 18 and older who at least have gotten their first shot. So we are in those are the numbers from today. And so, we are heading in the right direction, but we need to get that percent of the population that is fully vaccinated really up closer to 80% before we can go back to what many will consider a closer semblance to normalcy. There's a lot of discussion of, will we go back to normalcy? I think there will be things that will be changed. And some of those aren't bad things. I will highlight the fact that actually we have seen pretty much zero. It's not zero. We've had a case now, but very little flu. And part of that is that people have been very good this year, or at least much better than in prior years, about keeping their children home when they're sick, staying home from work when they're sick. We've had a long history of presenteeism, where we feel that we have to get in for that test, we have to get in for that work meeting, and we don't give ourselves the ability to recognize when we're ill. We need to recuperate. And I'm hoping that some of that will actually continue after this. If we're sick, we should stay home and not put others at risk.
Right. Yeah. So, Dr. Thyng, I wanted to ask you, as you see patients in office, and they are hesitant maybe to get the vaccine, what is it that you're talking with them about? What is it that you're saying?
I think most people who are, hesitant, they at least what I've found is they seem to feel that, personally, they don't feel at risk, and they are willing to take, the risk of contracting the illness. And really what I try to convince them, it's really, yes, the vaccines help to protect them personally, but it's really also there to help protect their family members, their community, other people they come in contact with, and really try to convince them that it's really, it's not just about them, it's really about our communities and our families. And if people really want to, get back to a sense of what they considered, normal, that this is our pathway to get there. So sometimes that works, sometimes that doesn't work. We try to do our best.
Yeah. And when somebody comes in and they have like already a suppressed immune system, is a vaccine still a good fit for them?
I think it's probably better than getting the actual disease. I mean, so somebody who has a suppressed, immune system, I mean, they're likely going to respond, less robustly to the vaccine than somebody who doesn't have a suppressed immune system. But, they're also at much higher risk of having severe complications from the illness itself. So yes, I do recommend the vaccine in those populations.
Okay, thank you. Let's see, we're getting a lot of really great questions. One of the questions is really interesting, and I'm curious if we have, the data to talk about it, but is the vaccine, can it cause future infertility or fertility problems?
No, so that's actually been looked at. It's actually interesting there. It was originally an exclusion criteria in the trials. There's been a lot of debate about that, about should we exclude individuals who are pregnant from these trials, because it means when the vaccines come to market, then we have this question of, do you give it or not? Having said that, there were actually a number of people who got pregnant in the trials for each of the vaccines, and they were equal in the arms that had the vaccine and those that got the placebo. And there's been basically a lot of debunked myths around the risk, and all of the major societies kind of around obstetrics have come out really in support of this vaccine. I think you're muted.
While we're working on unmuting, I was just going to jump onto something that Dr. Calderwood mentioned about the decreased cases of flu. In the pediatric realm, we will say our number of visits that we see for the usual colds, coughs, streps, ear infection, flus, things like that are significantly down compared to prior years. So the measures that we're doing to help prevent COVID-19 with regards to masks and physical distancing and limiting kind of groups, things like that, has also been incredibly effective with decreasing the other typical childhood illnesses. So it's one of those things that we'll be thinking about as we go forward with school settings, things like that, that some of the hygiene pieces that people have been working on, the fact that when your kids are sick, trying to have, avoid them coming back to school when, we were battling something is worthwhile. Things like masks when people are sick are things that we might think about in the future with regards to ways to decrease that. Because even after COVID-19 isn't as big an issue as it is currently, that every year we know there are a lot of missed days of school and parents' work because of childhood illnesses. So there's some things we've learned from this pandemic that'll be interesting for us to think about how we use those as we kind of continue to work on infection control in the future.
Absolutely. Yeah, that's a great point. I know I have a 17-month-old, so, and no ear infections this year. It's like magic. It's wonderful. So let's see. I have a lot of great questions. A lot of, medical, like people who are looking at their own medical background. So we have an anonymous attendee that says, both my husband and I have had COVID and are 2 weeks out from having our second Moderna vaccines. How worried should we be about getting one of the variants of COVID? And what precautions should we take to not come down with one of the variants? So with the, yeah.
Yeah, so I think the first part to that question is getting the vaccine if you've had COVID, because that actually comes up quite a bit. So maybe I'm glad to hear that these individuals have been vaccinated. We have had people who have actually gotten COVID in between the two shots. And we have to remember that you're not immune until 14 days after the second shot of Moderna or Pfizer, or at least not fully immune. And you're not immune until 14 days after the Janssen vaccine. And so, what often happens is if someone gets infected either before they're vaccinated or in between the two vaccines, it is still recommended that they actually get vaccinated. And that has to do with this question of how long you develop immunity following a natural infection. We have a sense that those who have milder illness or were asymptomatic may have a shorter period of immunity. But really the recommendation is that anyone, regardless of whether they've had the infection or not, should come forward and get vaccinated in order to boost their immunity, similar to what we're talking about this booster annually. And then the only group that we really are delaying vaccines on right now are people who have been treated with the monoclonal antibody therapy. And there are just some unknowns about if you got that treatment, if it slows or prevents your response to the vaccine. So we typically will delay vaccination of those individuals for 90 days. Now, the question around the variants is one that right now, we think that the vaccines are effective. Again, we think that the 3 vaccines that we're using in the United States are going to protect against the 5 major circulating variants. And so we've got the UK variant, the B.1.1.7, that is probably, well, not probably, it is the most common of the variants of concern that is circulating right now in the United States. We've seen it throughout New England, including in New Hampshire. Then we have the South African variant and the Brazilian variant. We have seen those in Massachusetts, but haven't seen them up as far north into New Hampshire. There's some question as to whether or not we're just not testing enough. But there are 2 new variants that are out of California, and we are beginning to see those in northern New England. And so we're keeping a close eye on this. Right now, I would view this as a battle that it is for those individuals who have been vaccinated. I'm less concerned. It's more about getting enough people vaccinated so that we don't have a rapid spread and further mutation of these variants. And the issue here is because they've got a higher rate of spread, we've begun to see that reproductive number. Everyone knows that this R naught, it actually is an RT. The R naught is where it is at the beginning of a pandemic, and the RT is where it is today after putting all the social mitigation in place. But anyway, if that's above 1, that means for each individual infected, they're going to infect more than one other individual in the community. And the variants are causing across the country that reproductive number to once again go above 1. And that's why we're seeing cases increase both here in New Hampshire and in states across the country. We have places like Michigan that's seen 150% increase in recent weeks. So we're really racing to get enough people vaccinated before these variants take over.
Yeah, which is why it's been opened up so much. Vaccinations are now this week. 16-year-olds by the end of the week, 16 and up will be able to get the vaccine. So yeah, and talking, I feel like we've been hearing a lot about this fourth outbreak or the 4th rise. So hopefully we can mitigate that.
Yeah, we've had, New Hampshire, thankfully, we've only had 2 peaks. Our most recent one peaked around the beginning of January. We were actually lucky and didn't have the peak in the summer that other areas, such as the Midwest, saw. As a country, we are beginning to see evidence of a potential 4th wave. What had been a really rapid decline in cases has now plateaued, and over the past week is starting to go up. What we know is that cell phone data is showing increased mobility. We've seen the highest rates of airline travel. In fact, we continuously are breaking new records as people are going on spring break. We've seen surveys of adults who are out in the community saying they always wear a mask begin to drop for the first time. It actually got up to about 72% of US adults saying that they, at least on survey, always wore a mask when they were out in the community. That's beginning to decline and is thought to go below 50% by the beginning of the summer. All of this is going to impact things. And it's just unfortunate that we're losing the battle on that messaging.
Yeah. Yeah. Especially, this kids are going to be on spring break soon. And so I think a lot of people are thinking that it's probably safe to travel. So if you were to give advice to a patient or a family member about traveling, what would that advice be?
It's probably not a one size fits all advice. And so what we know is that the CDC has been strongly recommending still against travel. At the same time, in the state of New Hampshire, we've opened up domestic travel. So you can travel domestically whether you're vaccinated or not and return without quarantine. Really emphasizing, if you are going to travel, think about the risk for those in your family who may not be vaccinated. And if you are traveling, think about how you can mitigate risk with masking and social distancing, thinking about avoiding large gatherings. And then when you return, it is recommended that you get tested on day 3 to 5 after you return, even if you're asymptomatic. That is a big strategy in terms of identifying variants that people may bring back into the state. So as people begin to travel, we really want to focus on testing, so we're not missing people who are infected and don't know it while they've been out and about.
Yeah, thanks. Dr. Thyng, I have a question here that I think would be great. So somebody is asking about, getting their cortisone shot or oral steroid for their frozen shoulder after the vaccine. Can they do that? And this kind of segues well into, what care should people be pursuing, medical care should people be pursuing once they get the vaccine or before they get the vaccine?
So I think the issue of steroids and when to time the vaccines comes up, fairly often. And I mean, I think there's a couple of scenarios. As some people are on, prednisone or other steroids on a chronic basis, and some people, like this example that you gave, just have an episodic need. So I'd say in that specific example, if that patient is a couple of weeks out from their, second dose, or a couple of weeks out from the first dose of the Janssen vaccine, then they're probably okay to get the injection at that time. I probably would wait to defer an injection like that until after that time for the vaccine. But I wouldn't, delay getting the vaccine if somebody is on steroids on a chronic basis, because again, like those other immunosuppressed, patients, they're at higher risk for complications from the disease as well. So I wouldn't necessarily hold back their steroids if they're on those chronically. I mean, it brings up, just kind of, routine care. And, I'm a primary care doc, and we found, a lot of people have delayed all their screening, their mammograms, their colonoscopies. And, it's important to continue to get those screenings. They were timed to kind of help to, decrease the incidence of disease. And if we, try to beat the system by delaying that care, we risk diagnosing things at a later stage. And I know many of our hospitals are finding people ending up in their emergency rooms in an advanced state of disease, or admitted with an advanced state of disease, just because people have put off their routine care for too long. So I mean, the message we've been giving is that we're open, we're safe. I mean, honestly, I feel safer, in our medical facilities than certainly going to the local supermarket. So we're here to see people and to help them, and we encourage them to come in for their routine care.
And I'll actually give a piece of data. I'll just give quickly a piece of data behind that, which is to say, we actually know now that working in a healthcare facility, you have a lower rate of COVID-19, despite seeing patients day in, day out. because of everything we've put into place around the masking, how we've set up our waiting rooms. And so there was this concern that those that were working in a healthcare setting might be at higher risk. And it's actually been proven that it's actually the opposite. So now many of our staff actually feel safer at work. Not everyone, but many feel safer at work than they do in the community, just because it's so heavily regulated. You walk in the door, you're handed a mask, it's an expectation. And so, I would feel completely comfortable coming in. And I will just reiterate that point. We have really seen some sad adverse events from people putting off care that is otherwise needed.
And I was just going to add in there, please have folks bring in children, grandchildren, whatnot for their regular care and their vaccines. We do not want to trade one pandemic for another because we let our vaccine rates decrease for some of the other vaccines. So again, we are open, we are safe. We encourage folks to come in for their regular care.
Thank you. So there were a few questions that that I thought were interesting. This concept of the COVID long hauler, where can these people receive help? Will the vaccine help them to recover from the illnesses that they've developed post-COVID?
That's probably coming to me, and then I'll let others weigh in. So, I think there's a lot of unknowns in terms of kind of this long haul. It seems to not be a chronic infection, but instead an autoimmune process where the infection itself causes your immune system to have an overly robust response and then begin to attack your body. There's also some kind of chronic inflammation that goes along with this. And so we've seen issues in the lungs and the heart and the brain with that kind of confusion that can go on for a long period of time. There have been people that have been really impacted by this. We have multidisciplinary teams that are coming together. This is going to be the next phase of COVID, is how we provide care for those who've recovered but have not fully recovered. We have a group that's actually standing up a clinic. They just gave a interview on NHPR last week talking about where that stands. So you can reach out to Dartmouth-Hitchcock and ask about how you can get scheduled in that clinic. I will say that they are really just beginning to learn about everything there is to offer. I wish that there were some really valid therapies. There are not at this point. A lot of this is symptom management. And so you may meet with a cardiologist or a lung doctor, a pulmonologist, and think about how to manage the symptoms. But in terms of recovering, we really need to study the therapeutics, and there are some trials that are going to begin around that.
Okay.
And I'd recommend that people, start with their PCP, to make sure we're not dealing with other things that might be mimicking some of those symptoms. And if nothing else, then the PCP can help to guide you where you may best seek further care.
Yeah. And Dr. Thyng, what are you seeing in the clinic in terms of people putting off care, or what are the real risks of doing that? What have you seen?
Again, the risks are diagnosing things at a later stage. So in the examples of screening tests, somebody, doesn't get their colonoscopy, the colon cancer, develops into something, bigger, and they end up in the emergency room with a, GI bleed. And, oh, by the way, you have advanced cancer, So there, multiple examples, somebody with hypertension who doesn't come in for their, for their routine care, and they have a stroke, So lots of examples for multiple illnesses where things could go wrong by delaying care.
Yeah. Great question. Can someone donate blood when they are close to their scheduled vaccination? Is blood donation okay?
Are we talking about someone who's recovered from COVID, or are we talking about?
Can someone donate blood close to when they're scheduled to receive their vaccine? And will giving blood reduce your antibodies?
No, that should be fine to give blood. And in fact, if you've recovered, you can give plasma to help others as part of recovery. That is a therapy that is available and can be collected from people who have recovered. So no, it is not a reason not to get vaccinated or not a reason to hold off. And right now, we have great needs for blood. So if you are a donor, please come forward.
All right. Let's see, we've got so many questions. I've had COVID-19. How long does my immunity last? How long does that?
Kind of addressed
there-
that one a little. We talked about that one a little bit earlier, saying
Yeah.
we've detected the antibodies out to 6 months and probably longer, but don't know.
All right. All right. There's so many. Are there any exceptions for kids? So we have somebody whose child is almost 16. Would there be, do you know of any exceptions for getting her in just a little bit early?
The answer is no. No, it's if we start creating exceptions, it's yeah, it'll be there soon enough.
We'll get it there. And so I guess, can we just talk about, we're getting towards the end of our webinar today. Again, if you have questions that we didn't answer, feel free to use the survey that will come to your email that you registered with as a tool, and you can send your questions in that way and we will try to get them answered. But I just wanted to touch a little bit on, again, like stressing the importance of not putting off your care and masking and social distancing and doing all of that to keep everyone safe. Does anybody do you have any final thoughts on where we are and how far we've come and how far we have to go?
I've spoken a lot. I'm going to let the other two go first.
I'll just say that our staff, have really enjoyed, participating in the vaccine administration sites. I mean, it's such an efficient process. The amazing number of people they can get through in a day to get their vaccine. People are, happy to receive their vaccine. It's just, I mean, we thought we'd have some difficulties with getting people to help to support the sites, but people are asking us to go. So I've been really proud of the effort to get the vaccine out there to everybody.
And then I was just going to call a point, just because I think it came up in a couple different places, that we know that over the course of the last year with the pandemic, there have been a lot of concerns with regards to mental health and behavioral health among all of our patient populations and ourselves. And so I just encourage folks, one of the two greatest things you can do as a single thing to be able to help out with mental health is fresh air and sunshine. And luckily, both of those things are free. And at the moment, as we're getting a little bit warmer, I encourage everybody to get outside, get some fresh air, get some exercise, move around. Again, they're the single best things we can do to be able to help out with our own mental health.
And, I will end with a couple of points, which is to say, there is still a light at the end of this tunnel. There will be an end to COVID. And we are seeing incredible numbers in terms of people being vaccinated. A lot of people have referred to this term vaccination, which is the elation you feel after being vaccinated. A number of people that have sent me a photo from across the country after they've received their vaccine. And even just this past week, and as I was working in the hospital, we were vaccinating teachers and others in the community, and there was just this roar in the lobby of people that were just so excited to be getting this vaccine. What my fear is that we will get up to about 60% and then begin to see things tail off. And so I want for people to continue to ask questions and feel comfortable with the vaccine, but really to get out of this pandemic, we are going to need about 80% or more of the US population willing to roll up their sleeve and get that vaccination. And so if you've been vaccinated and you want to talk about how easy it was, how the symptoms maybe were mild, but heck, they only lasted a day. The things that you're able to do now, we need to continue to talk about the safety and what this means in terms of our ability to really return to normalcy. The last thing I'll say, and I just want to highlight this to this group, I'm really excited to see many of the schools beginning to reopen to in-person. My children have been lucky enough to be in in-person school since the beginning of the year. And that was fine. It depends on your community. But what we know is that as long as you're maintaining kind of distance of 3 feet and people are masked, we have not seen outbreaks in our schools across the state. What we're seeing in terms of people testing positive is actually happening outside the schools. The schools have been incredibly safe due to all of the work by the teachers, the administrators. They've just done an incredible job. But it is important for their education, for their mental health, for students to be in the schools and to have those schools have policies that keep them safe. It can be done. It has been done. And I'm excited that we're seeing more of it.
Well, thank you all again, Dr. Shessler, Dr. Thyng, Dr. Calderwood, for being with us tonight and for talking us through some of the myths of the vaccine and the benefits of the vaccine. And hopefully we've answered as many questions for you as possible. Again, please submit that survey. And if you have more questions, there is a space for you to ask those questions on that survey. And I would say I got the vaccine, and I did have that feeling of superpower. And I encourage everyone to really ask questions and get your vaccine. And but just remember to social distance, wear a mask. We're almost there. And I couldn't be more grateful to work for Dartmouth-Hitchcock and to work with all of you. And so thank you for your time and your dedication and your brains today. I appreciate it.
Thank you so much.
Thank you everyone for attending. We hope you have a wonderful evening. Stay safe.